Well, while we're on the topic of Italy, they seem to be doing worse and worse, not better and better. The images that we see coming out of Italy are reminiscent of pretty much a core meltdown of their healthcare system. We had talked earlier about what the potential causes, why more people get sick and why the mortality is so much higher there. Do you believe that that's related to age? There was some report that 60% of the Italian population was over the age of 40. Would that be enough to really explain the higher death rates in Italy?
Well, it's part of it. 23 to 25% of the Italian population is over 65 years of age, as compared to 16% in the United States. They also have a healthcare system, at least in northern Italy, which is largely a rural area, that is not sufficient, I think, to handle a massive outbreak that requires intensive care. So I think that was also part of it. And now with this sort of family in New Jersey, and if this report is true, that 4 Italian members of a family, some of whom were young, caught COVID-19 and died from it, it makes you wonder whether there may be a genetic predisposition to this as well. Mm-hmm. And then there are other things. I mean, Italy is more likely to smoke. Italy is more likely to smoke. And maybe they're more likely to hug than, say, Americans. I mean, there are a lot of things that have been brought up there, but clearly Italy has, I think, now passed China in terms of number of deaths, even though they're a population of 60 million compared to China's 1.4 billion. China has stopped spread. To their credit, they have stopped spread.